A 28 years old female present with a small nodule located to the back of her neck. It is excised for cosmetic reason, and histopathology report states that the lesion it is consist of sebum filled lesion surrounded by outer root of the hair follicle. So this is very important. That means it is just like this type of lesion, and it is filled with the sebum, but the outer part there is the here. So what may be the diagnosis? Here the options are the pillar cyst, seborrheic keratosis, dermatofibroma, atypical nevus, and split nevus. So we have to find out one of the options. Here we have to keep in mind that there is a sebum present. That means when there is sebum present, that means it is the content of the skin, because the sebum it is secreted by the sebaceous gland of the skin. So this tumor or this lesion is present in the skin, not in the other area. That means not in the connective tissue, not in the muscle, and not in the other area. That means it is solely a content or solely a tumor of the skin, but it has the outer sheet of the hair follicle. That means the follicular growth inside the tumor, not outside the tumor. So here we can see this is the this type of the lesion, and surround the lesion, that means this type of the lesion there is the hair follicle. So this is let's see the epidermoid cyst. It is common in face and trunk region. That means face and back of the face, that means the head, and they have central punctum. There's central punctum, but 70% of the cases, that means in all cases there is not punctum. Punctum pelvis present almost all type, but there is no present of the central punctum about the 30% of the case. But there may be a small quantities of the sebum, or sometimes there is wholly filled by the sebum, because the sebum is secreted by the sebaceous gland, and this sebaceous gland is located in the skin. The cyst lining is either normal epidermis, or sometimes what occurs when there is normal epidermis, then it is called the epidermoid cyst. But what open when the outer root sheet is here, then what is called, this is called the pillar cyst. So this point is very important. When there is pillar cyst develop when there is the sebum inside the lesion, but the outer part it contains the hair. Because what happen in the skin, here we can see there are different type of the skin, but sometimes what develop when the tumor develop, then the skin this hair goes inward. So in this condition the skin develop inside this lesion. Usually the hair present outside the body, but sometimes they present in the tumor, and when they present in the tumor in this condition, it is called the pillar cyst. So it is another type of this skin cyst or epidermoid cyst. So what is it? When there is this sebum filled and outer hair follicle. So this is the key point for us. One of them is the sebum filled, which is secreted by the sebaceous gland. Second one, here the hair follicle present. In this condition, our answer will be the pillar cyst. Thank you all.